Welcome to 97.7 FM, and welcome to another great edition of Nature's Remedy Center with Dr. B. As always, we've got a great episode. This episode is about anxiety.
Yes,
So, without further ado, Dr. B, welcome.
thank you for inviting.
So,
And
now
it's a,
tell us what this is all about today.
well, today we're gonna start talking about the brain because many people. I'm gonna talk more of my experience with anxiety because I do help people with that. But lately, those two past years from back is worse now. Almost everybody has some anxiety, and they get to the point that some people doesn't work for 1 month, 2 months, or they go to work and come back home because they start with tachycardia and high blood pressure and shorter breath. So it's really increased a lot.
And it's not a coincidence, but just this week we were discussing that a lot of special ed departments are getting a lot of referrals for the same thing
For
for
the same, yes.
for anxiety, for speech
Hmm.
impediments, and like never before, the numbers are skyrocketing.
Yes, like I receive a lot of people with anxiety, and the end result of anxiety is really panic attack. So if they don't treat, they will go until they have panic attack. And when they have panic attack, in the past, I help people with that. They would call me from the middle of the road and say, "I cannot drive." Like they are panicking, or that when it's really severe, they don't go out of the house anymore. They cannot do anything. They scare, afraid of everything. But this is reversible. It's really reversible. Takes a while, but it can be reversible. And the panic attack is the last stage of anxiety. Look, so really they need to treat. If they don't, they end up with ER visits often.
That's right. That's right. So let's get started. What exactly is anxiety?
Well, anxiety is when they have a sense of an uneasy feeling and they worry, they are nervous, they have uncomfortable feeling, a vague fear or apprehension. They can be uncomfortable and potentially debilitating, like physiological, like they can have worries too much for anything. They make a storm in a glass of water, and feeling of threat, and physiological arousal like tachycardia, shorter breath, and so the high blood pressure goes up. So that then they go to the ER when they get to that point. Most they visit the ER,
Hmm.
and that's something that you can manage to before get to that point.
That's right. And I know that there's classifications of anxiety disorders, right?
Yes, like usually, like the first one is called generalized anxiety disorder. It's called GAD, like it's just the general. And then panic attack, like I say, is really the end phase of the anxiety. Like if you don't treat, build up, and then you end up having panic attacks often. Could be every day. I did have clients that would have every single day panic attacks. They would go to work and come back home by afternoon because they couldn't handle like shorter breath, a racing heart, and things like that. And then we have the phobic. They become a phobic disorder, like they're afraid, phobic of close, like closed
The
rooms and air
claustrophobic and all
claustrophobic,
that.
all that stuff. And then we have the PTSD, when the post-traumatic stress disorder, like if they went to war, if they were a soldier, so they usually come back with a lot of anxiety because what they saw and what they live there. But all these can be treated. All these can be reversible. And then we have the OCD, obsession compulsive disorder. But this everything has to do with the gut. But the OCD is the really is when the person, like for any reason, the myelin of the neurons, they got attacked by your own body. So more the destroy the myelin, so there is no connection on the brain. So one of the first symptoms they'll have, they become OCD. Like they walk only in a straight line, they cannot make curves, so they do a lot of things that they think they are right. but they become obsessive compulsive disorder. But really, what it is something is damaging the neuron, like for example, a person that has Tourette syndrome. Often that child had too many strep throat infection, and then what really is in the brain, we have antibodies for streptococcus, and they attach to the myelin, and your own body attack and destroys the myelin. So that first they will start with OCD, obsessive compulsive disorder, then PANDA, and then Tourette syndrome. Like if you don't treat, it's going to develop to something else. But it's all first the gut. So we have to
Oh
treat the
wow!
gut.
It
Yes,
all goes back to the gut.
yes. It's
Wow.
always the gut first.
And so I know we're talking about the symptoms of anxiety disorders. How do we know exactly when it gets to a problematic phase of, okay, this is just me being, the difference between, oh, this is just me being worrying about something, to where, no, this is anxiety. I'm actually anxious about this, and
Like
it's a disorder. How do
the
we know?
symptoms you start like anxiety disorders. Like first they'll be sensitive to noise. Like things go little by little, and then they have dry mouths, difficult of swallowing, palpitations, restless, tremors, gastrointestinal discomfort. Because remember, it's the gut first, the second
It
brain.
upsets your
Yes,
stomach.
and
Gotcha.
usually they don't follow a good diet. Like
Mm.
they eat gluten, dairy, fried foods, caffeine, sodas, so they don't have a good diet. So first, the gut needs to be gone. Is the second brain, and then they have headache, insomnia, constriction of the chest. They will have a discomfort, chest pain, and poor concentration. So those you notice one symptom here, one there, then it starts escalating. Then it happens often to be diagnosed with anxiety disorder. So first, really, you are what you eat. So if you have a good diet, your gut will be in good shape. Why is the gut first? Because the gut is responsible for 75% of the melatonin,
Mm.
serotonin, that's all brain chemicals. And then you're going to have 75% of your immune system. And so if the person doesn't have gut in order, they're going to have chemical imbalance brain, and then they will develop those things. And another thing that we're going to see that really, when they have a panic attack or anxiety on that day, it's they have the leak on the gut. So when they eat animal products, the undigested animal product goes to the bloodstream, and then they call peptides. When they call goes in the brain, and then they have panic attack.
Mm.
Yes, then
Wow.
they will have panic attack. So it's not a 1 day process. It's little by little to get to that point. First, they're going to start have anxiety. Usually, it occurs at night. Panic attacks too, but then when it's way advanced, they have any time, any minute. But usually they will have a trigger for. And usually when they eat animal products that won't digest, and then peptides goes to the bloodstream, goes to the brain, panic attack. So,
Oh,
but
yes, I
it's
get
not
it.
1 day, so it's take little by
Mhm.
little. But the main thing is the diet. The main thing was the diet first.
And
Yes.
and is this also related to clinical depression?
Uh, eh, yes, because if you have anxiety, like you're gonna develop depression because your brain is inflamed. Like all those disorders is linked to the gut, and the depression, it's brain inflammation.
Okay.
It's your brain is in fire. So all these disorders, your brain is not doing well. Lack of circulation, and chemical imbalance, and inflammation.
Got it.
Is
Got it. Got it.
inflammation.
Now, moving on to, I guess, number 5, the
Mhm.
diagnosing clinical presentation.
Technical presentation, okay. Often happens, like I say, that when they have panic attack, often it's nighttime when they are in the
Okay.
beginning stage. But then when they very advanced, could be every single day. Like I saw people that couldn't work for 1 month or 2 months. Like they couldn't do it. Like they feel so bad that they stay home. And then, uh, and also usually they would, like I explained to you, is after animal. They
Eating
eat
animal
animal product.
products.
Yes, because you know already undigested protein goes to the bloodstream called peptides, land in the brain, panic attack, and then a panic attack usually peaks like 10 minutes and don't last longer than 30 minutes. But you feel
Mhm.
like you're dying. You know the person feels very uncomfortable. They rush to the ER hours. A patient that is diagnosed with panic attack disorder after 1 month period of or more attacks. So to be receive that diagnosis, they have to have during 30 days more than one attack. And during the attack, individual will often feel like they are losing control or dying. It's a bad feeling. That's why they go rush to ER. And when I used to work in the hospital ER, we used to receive a lot of those panic attacks. And usually when they have a panic attack, they can put a paper bag and breathe on it. That will help a little bit. And then they can take magnesium or anything to calm down so they can come back. And when they have a panic attack, it's a disorder that defined by the presence of recurrent or unpredictable panic. So when they have panic attack, like I say, is the last stage. So could be any day, any minute that they go in panic attack, which are distinct episodes of intense fear and discomfort associated with a variety of physical symptoms, like for example, uh, palpitations and sweating, and that's why they feel they are dying, because they start having all this feeling, high blood pressure, trembling, shaking, sensation of a shorter breath, chest pain, nausea, feeling dizzy, fear of dying, and numbness and chills and hot flash. So all this goes during the panic attack. So that's why they think they are dying. They think that
Mhm.
is they are dying, so they rush to the hospital. But this is just is reversible. It's like what you really need to do is clean the body. Now here we're going to discuss too,
Okay.
because here on the what causes anxiety, we
Mhm.
know first is the gut. So they have the leaky gut. Undigested animal product goes to the bloodstream. Then they have, because they have a bad diet, so the liver is full of stones and parasites, and the GI, the gastrointestinal. So they have too much trash on the body, like on the liver, gallbladder, and all the intestine tract. So they have to clean up all this. And then they have chemical imbalance because the gut is not working. Because, like I explained before, the gut is responsible 75% for the serotonin, melatonin, the immune system. So these all come from the gut. So they won't be able to sleep because the melatonin, and they won't will be able to feel happy because the serotonin. So it's all linked. So in order to have any brain problem, you need to have a gut problem. And to have a gut problem, you need to have a bad diet. Or you took too much antibiotic or chemicals or things like that. And then it could be spiritual too. Because, for example, a Christian person, they're more balanced and they thoughts emotionally, like they don't fear for any little things because they trust that God's going to help them. So people that don't read the Bible, pray, they have too much worry about. They have too much fear about life. Like one time, I used to live in Maryland, and a friend of mine, we are Seventh-day Adventists, we're Christians, and then she has to move to Brazil, and she was like worried to death because she had 30 days to sell everything and go back to Brazil. And then I told her, you shouldn't be doing that. Like, if God wants you in Brazil in 30 days, you're going to get everything done before 30 days. And that's what happened. It was God's will for her to go back to Brazil. So she sold everything in 30 before 30 days and was ready to go to Brazil. So when you're a Christian, you have to trust God. So you're not going to be worrying about to death for anything or fear. So it's a spiritual too. But when your gut is in balance, your brain is in balance, you cannot think like that. The first thing that you're gonna do is cry about or express feelings, fear or worries. But when you put God in first place, that you read the Bible and pray, uh, this is not going to happen so often. But if you're a Christian and you have a bad diet, you will have anxiety and panic attacks too. Okay.
Wow, which kind of leads us into the next question, which is what are some of the foods that cause brain inflammation?
Yes, the main one is gluten. We have to avoid gluten because gluten is a man-made protein, was made on the 1970s, and it's because like when you go to depression time, so they need to feed the population, so they are trying to invent something that would feed them and low cost. So they invented that, but now the whole wheat it's contaminated because that with that protein it's the gluten. So you cannot, everything has gluten, but you have to avoid because gluten has gliadin and inflames, it's a neurotoxin to the brain. And the milk has casein, it's causes inflammation of the brain. And then we have the famous MSG that we have to avoid. MSG is the number one cause for migraines. Number one cause for migraines.
And it just makes food taste good, or it makes our brain believe that the food tastes really good,
so
right?
like those chips, the corn chips, all this things. It needs to be. That's the purpose, to make taste good. Think that it tastes good for you to eat without stopping. But then you're gonna become very obese too.
Yeah.
It's gonna, and that's the number one cause of migraine. It's the MSG.
MSGs in the food.
Is MSG.
Wow.
So you have to avoid all those foods like sodas, caffeine, high fructose juice. All it's neurotoxic because it inflames the brain. Anything that inflames the brain, it's a neurotoxicity to the brain, like alcohol too. So it has a big list for those things.
Wow.
Yes.
And so now how do we detox?
Yeah, how it detox, because by experience, I saw that can be reversible. The first thing we do, we teach them how to detox. Then we teach them how to eat, and then we teach them how to food combination, and then we give the supplements. And then takes depends on the case. Some cases go faster, some cases take a while, like minimum 6 months. Because like one of my patients, he had anxiety and panic attack. He did the liver gallbladder flash many times, more than 10 times. So his liver was full of stones, biostones, and gallbladder, and then plus the gut was full of candida and parasites. So it took a while, but he got well, and today his anxiety and panic free. Many others too.
That's fantastic.
So you have to first do the liver gallbladder flash detox, and then you can do that every 2 weeks until you see when you do number 2 there is no more trash there or biostones that they are green, and then you can do a colon cleanse. But usually when they do the liver gallbladder flash, it cleans the colon the same time because it comes all the way from the liver all the way down. But if it's a small children, we give the colon cleanse. We put the colon cleanse with a probiotic for 3 months because
Instead
they
of
are
the-
little, they cannot do the liver gallbladder flash. That before 15 years old, we do with colon cleanse, and we do with a heavy metal detox, things like that. So for the 15 under, when they are 15-year-old, they can do the liver gallbladder flash, and the liver gallbladder flash takes care of the trash, physical trash of the liver, gallbladder, and the intestine. And then when they're older, they can fast. Like when you fast, you reset the DNA. Like when you fast, you reset the DNA. And you reset everything, all the rhythms that the body has, you can reset just by fasting. And then we can help with supplements because while they are detoxing and correcting their diet, they have panic attacks or they have anxiety, we have to give some supplements to avoid that, to counteract those things. And also, another thing that they can go, ozonotherapy is a detox too. They can do bat detox with Epsom salt. So there is many ways to detox the body. But to take the trash physically, the best one if they are 15-year-old, is the liver, gallbladder, flush, because that cleans a lot of things. And why is important to clean all the organs? Because like before you have a heart problem, you have to have everything clogged up. First you clogged up your colon, then your liver, then your kidney, then lymphatic system. Then the last one will be the heart. So that's why it's important to have everything clean. And how after you clean, how you can maintain clean those things by eating properly, eating correctly, and the proper food combination too. So
That's fantastic, and that'll give us the clear minds and strong bodies that we need.
yes, and then the supplements that they can take is like I say, while they are cleaning themselves and correcting their lifestyle or diet, they can take something for anxiety. That we have many products that help, like ashwagandha, magnesium, DSA, anxiety. So we have many supplements that help you to deal with the anxiety while you're doing all this cleaning up on your body and resetting your body. And then we have to fix the gut. The supplements for the gut, you need one to digest, to absorb, and to repair. You need one product that do all three things. Because the repair, you need to repair the line, and you need to put the normal flora. And the gut cannot be repaired before 6 months. You need 6 months
To repair it.
to repair, because it's the line. You cannot fix that. It takes about 6 months to repair that, the line of the gut. And then you have to take a digestive enzymes to help you digest the food while your body is still not working, and anti-inflammatory, because any brain problem, that's meaning you have inflammation, so you have to lower the inflammation while you're repairing. And then what supplements that we can take? The supplements like this is the brain food. The supplements that's your brain loves the food. Like you can repair your brain with brain food, but you have to address the problem, like the circulation, because we don't know what causes the brain to go down. So, but this is called brain food, and we can drink daily is iodine, Lugol's iodine, lecithin, magnesium, B12. I prefer B6 complex, but it has 12 inside. And especially for the population in the valley, most of the Spanish descent, they don't have enzyme to process the B12. So they have to buy the B12 already processed in the form. Yes, because if they drink B12, they have will be on the blood, but it doesn't go inside the cells where they need to go, and they can have allergies, reaction. They can have different symptoms. But most people in the valley, they do have this enzyme deficiency. So when we give B12 for them, we need to be giving already processed, because their body doesn't have that enzyme to turn into the way that the body can absorb. And another thing is zinc. So this is called brain food supplements. Okay, so first you repair the gut, and then you feed your brain with the correct food. And here's the last one that we're gonna see. Like if I wanna have a clear mind and a strong bond, the first thing that we have to do is avoid sugar, because sugar damages the brain. Like here we talk about damaging the brain to the gut, but sugar can damage the brain directly, because now we know that Alzheimer's type 3 is sugar, you see. So if you want to be healthy, we do have to avoid sugar to all costs, because disturbs the stomach and produce like impatience, irritability, and those who accustom themselves to use. And we should not prevail it upon to take anything into the mouth that will bring the body into unhealthy state. So if you want to have a good brain, this one, the sugar can straightly damage the brain. Okay, because you're gonna have Alzheimer's, that we know for now that is really diabetes type 3. So I hope we could bring some good information for you about anxiety, but so now you don't need to be in fear, that there is a solution for that, that you can recover.
That's fantastic. And of course, if you have a lot of questions and you want to contact Dr. B directly, you can do so. She is located in McAllen at Nature's Remedy Center in McAllen. Doctor, what is the address on that?
It's 508 North 10th Street, Suite C10, McAllen, Texas 78501. And our phone number for the office is 956 631 1664.
That's right. Call, set up your appointment, speak with Dr. Barbosa, Dr. B. And also go online, check out her website. She's got a lot of information on there. And the website for that
Is naturesremediesctr.com.
Nature's Remedies CTR, short for center,
Mm-hmm.
naturesremediesctr.com.
Yes.
Well, thank you for this very vital information that you're sharing. And again, in 2 weeks, we're going to be presenting the same information in Spanish. So make sure you tell your friends who are Spanish speakers to log on and check out the show in 2 weeks.
Yes.
Well, thank you once again for joining us. We want to thank everyone that joins us through YouTube, through Facebook Live, through 97.7 FM, online. And we encourage you to contact Dr. B and get some more information on that. And until next time, keep listening and keep watching 97.7 FM, the city.
Thank you.